consensual sex, which is quite safe, right? There's not much accident happen. But let's say if you got sexually assaulted, raped, and then some accident happen as well, what should you do?
Well, you need to do what you need to do.
I guess
basically,
if there has been a sexual assault, there are a number of things you can do. You can go to the emergency section of a hospital to actually be treated in hospital for if you have any injuries that they can be treated. You can, if you elect to do so, have a rape kit taken where they could actually do check for fluids that the perpetrator might have left behind and things like that. And so it's important to remember that if you have been assaulted, you can go to emergency and actually get treatment there.
Okay.
Yeah.
But not everyone wants to report or go to the doctor.
Yeah, that's right.
Sometimes unfortunately, some people, they are very shy, so they rather just keep it to themselves.
Yes. I think just picking up on what Sarah said, it comes back to what the person wants to do. So they have choices. They can report it immediately to the police. They can go to a hospital and report it. They can go home and tell a family member who then may choose to report. They may then choose to report it. If you're not going to report a sexual assault, go home, have a bath, soothe yourself.
Okay.
Then the next day go to your doctor, tell him what's happened, be upfront so you don't want to report it. He'll give you a full STI check. You may decide to take the morning after pill, for which you don't have to go to a doctor, you can just go to a chemist.
Mm-hmm.
So you can go and get the morning after pill from the chemist, you can go to your doctor and get an STI screen. If you think that you might have come into contact with HIV, then you can access what they call PEP, which is post-exposure prophylaxis.
Okay.
So those
the purpose of that is try to kill all the virus.
To kill the virus.
Yeah, to stop the virus settling into your body. And so there's the morning after pill as a contraceptive
For the female?
For female, for cisgendered women. And then there's also the PEP for if you think that you've been exposed to HIV. And that's not just a pill, it's actually a treatment, a series of pills that you need to take over a month. And you should do that within 72 hours of your exposure to HIV.
If you don't do during the 72 hours,
the chances of the chances of contracting HIV increase, and so it's best to go and get PEP as soon as you possibly can if you're concerned that you've been exposed.
Okay.
And with PEP, you take the medications for a month, and then you need to be tested again within the next 3 months.
Yeah. So just taking taking PEP doesn't mean that that's it. That's all you have to worry about. You have to go back to be tested.